Northern Cape Premier Dr. Zamani Saul will today outline the province's vaccine rollout plan. The province has recorded the lowest number of deaths from the coronavirus. Active cases currently stand at 3,890. Let's take you to that briefing now.
Joining us on Microsoft Teams can send questions to a cell number, but I will now request that you will send your questions through on the Microsoft Teams platform after Premier has addressed us. I'll immediately hand over. Thank you, Premier.
Thank you very much, Bronwyn, and I'm here with the MEC of Health, who's actually sitting with the primary responsibility to lead our response to COVID, and I've got the senior government officials right here. Who are in a combative mood and combat ready to respond to all the questions that we are going to be receiving. And we want to pass my greetings to the members of the media who actually made time to be part and parcel of these engagements, and also want to apologize for having to postpone the time which we initially designated for these engagements. Bronwyn has already mentioned that we had some technical glitches. Ladies and gentlemen, thank you for joining us at this important briefing this morning, which signifies an important step in our fight against global coronavirus. In response to COVID-19, our province adopted a multi-sectoral approach and established the following to curb the outbreak. We had health responses, we had law enforcement and compliance with regulations, we had food security and social relief program, which was one of the most extensive social relief programs that we've ever embarked on, where we actually distributed food parcels to poor households. And we've got the economic response and social mobilization. To date, the COVID-19 pandemic have manifested in two waves in the province, just as we've experienced nationally. The first wave started when we had our first confirmed case on the 25th of March 2020. And the first death occurred on the 11th of May 2020. So the first time we had our first COVID case, it was 25th of March, and we experienced the first fatality on the 11th of May. As a provincial government, we extend our sincerest condolences to the families that have lost loved ones due to the pandemic. We also wish everyone who has been or is affected by COVID-19 a speedy recovery. When we speak about COVID fatalities, we are no longer speaking of figures now, we speak of names. We've got names of people that you know who have succumbed to the virus. And so that's one element that brought in a greater degree of consciousness around the existence of the virus. The Department of Health, together with our stakeholders, have prepared in excess of 3,300 beds, including ICU and high care capacity, with a huge investment in staffing, equipment, vehicle, etc. So as we are preparing ourselves for these surges in the transmission of the virus, we've got 3,300 beds, COVID beds. And I think we've reported this late last year, the number of beds that we have and the new equipments and the vehicles that we have bought. In December, we launched 75 new emergency vehicles, consisting of 65 ambulances and 10 patient transport vehicles, as well as 55 clinical outreach parties, to strengthen the response capacity of public health care to communities in the province. Very significantly, we appointed 424 clinical professionals ranging from medical officers, pharmacists, nurses, and allied health professionals in all districts at an annual cost of 197 million rand. So we also ensure that our human resource capacity is strengthened, so that as soon as people land in our facilities, there are people who are appropriately qualified to respond to their medical needs. We invested heavily in additional medical equipment to combat the pandemic, including 35 ventilators, we've got 16 blood gas analyzers and 225 CPAP machines, 2,268 infusion pumps, 107 automatic defibrillators. The cost of this investment is about 120 million rand. It must also be noted that in this time, we received 11 Cuban Brigade doctors, health technologists, epidemiologists, and biostatisticians who have contributed greatly in our fight against COVID-19 pandemic in the province. I think we have to pass our regards and gratitude to these Cuban doctors for their sacrifices in the province. From mid-July 2020, there's some noise. Yeah. Okay. From mid-July 2020, the number of new confirmed cases of COVID reported daily has been declining in the country. Despite this trend in the country, the province experienced a delayed increase compared to the national average. As the Northern Cape, we experienced a flattened peak where we recorded during week 30, the week ending the 26th of July 2020, a high of 1,552 new cases. Our highest peak in the province was during the week of the 20th of September 2020, when we recorded 1,644 new cases for the week. The first wave was officially over during the week of the 9th of November 2020, when we reached 328 new cases for the province. So what this actually means is that the first wave, which started with the first case, ended during the week of the 9th of November 2020. In summary, for the first wave, we had a total of 22,725 cumulative cases with 301 deaths. That's the devastation of the first wave, 22,000 cases and about 301 people losing their lives. The outcomes of this was used to implement additional numbers to prepare ourselves for the next wave. The second wave started during the week of the 14th of December, when people were preparing themselves to go on holidays, were preparing themselves for the festive season, when we saw an increase of 425 new cases. There was a speedy escalation which went into 2021, where we found a consecutive weekly increase of 706 and 1,041 new cases. In January 2021, we started with a record weekly high of 1,727 on the 10th of January 2021, and again a new weekly record of 1,898 by the 17th of January 2021. In summary, ladies and gentlemen, we had for January 2021 a record of 6,762 new COVID-19 cases, which is higher than any month since the pandemic started in March 2020. So what this means is that January, the month we just moved out from, was the worst month with regard to infections in the province, where we had close to 7,000 people who got tested positive with COVID-19. And this translates into a daily average of about 218 new cases. For the second week in succession, The province registered a significant decline in new cases after experiencing a rapid rise and the highest peak during the second wave of the COVID-19 pandemic. During the past week, which ended with 31st of January, the province recorded 1,048 new cases, which is 26% lower than 408 new cases recorded in the previous week. Clearly, the second wave is getting under control through the collective efforts and sterling work being done by our healthcare workers, support staff, and all our stakeholders. So, colleagues, comparatively to other provinces, we are doing extremely well. Where our mortality rate is 1.8% compared to the country's mortality of 3.1%. As a province, with our 595 deaths to date, we should have had a total number of deaths of 998. I just want to explain this a bit because the mortality rate, the percentage of people dying from the total number of people who are positive is 3.1% in the country, and in the province it's much lower. It's almost half of that. It's 1.8%. We can see that our investment as a province of about 500 million rand is bearing fruit where we strengthen the response capacity of our healthcare system. With the reprioritization of our budget with the advent of COVID, we reprioritized 500 million rand to the Department of Health in order to strengthen its capacity to respond to the virus. And so with all of these achievements, the low levels of transmission, the low levels of fatalities, we actually see direct benefits of the kind of investments that we have made in the Department of Health. We need to recognize that all our stakeholders, NGOs, mines in particular, that made a contribution in excess of 100 million rand, and our private sector in general. I think if it was not through the generous contribution of all the stakeholders, we would not have been where we are. So we are very thankful and a sincere word of gratitude for the contribution which they have made in our fight against the virus. Despite all these gains, we need to emphasize that we are not out of the wood as yet, and we have to continue to prepare for the third wave. The areas of concern in our province that are on our watch list are Pokwane in Francisbard, Kamagara and Khasikhonyana in JTG, Mtanjeni, Siatemba and Siangoma in Pixley Kaseme, Khatilopile and David Creeper in ZFM, Namakwa, Namakoi in Anta, Namakoi and Anta in Namakwa. So we are calling on all our residents in the province to continue adhering to the measures and not to let their guard down. So, ladies and gentlemen, let me now proceed to the business of the day and the reason why we have called this session. The first batch of life-saving vaccines have arrived in our country, marking phase one of the vaccine rollout. As indicated by the President, all healthcare workers will be prioritized for vaccination during this phase. The transportation security to the primary distribution sites in the provinces, including the Northern Cape, will be done by vehicles fitted by tracking systems and escorted by Fidelity Armed Response and SAPS. The South African Vaccination and Immunization Center at the Sefako Makgatho University are leading the development training for healthcare workers, which will consist of 6 modules. A national online training program was held on the 15th of January 2021, which was attended by 245 from the Northern Cape. All vaccination sites will have at least 1 master trainer. So we've already trained about 245 staff from the Department of Health in the province that will be responsible for all the vaccination sites. Now that the vaccine is in the country, the national plan is that this will be delivered to the provinces between the 7th and the 9th February, and the actual vaccination of healthcare workers will start on the 10th of February. Access to COVID-19 is the government's highest priority. That's our priority number one now, and particularly with regard to protecting our frontline workers. Our target is to vaccinate 67% of the population by the end of 2021. And 67% in the province, roughly, it's about 900 people that must be vaccinated by the end of the year in order for us to reach what is called as herd immunity. The rollout will take a three-phased approach that begins with the most vulnerable in our province. Phase one will focus on 14,000 frontline healthcare workers, which means with the first phase that is starting on the 10th of February, we'll be having 14,000 frontline healthcare workers. And phase two will see us vaccinate essential workers, persons in congregate settings, persons over 60 years, and persons over 18 years with comorbidities. And phase three will focus on the remaining population. In phase one, which is about to unfold, the province will be receiving 14,000 vaccine doses early next week in the first allocation from BioVac for the initial rollout to patients-facing personnel, 10,000 public sector and 4,000 private sector. This is both for patient-facing personnel in the private and public sector. And for public sector, it will be 10,000. And for the private sector, it will be 4,000. The additional allocations of the vaccine will be used to vaccinate the remaining healthcare employees, followed by the categories identified in phase two and phase three. In phase one, we'll roll out the vaccine to 15 centers in a phased approach as follows. In Robert Manganiso Sobukwe Tertiary Hospital in Kimberley, there's about 2,080. In Dr. Harry Surti Regional Hospital, 910. Robert Sobukwe Tertiary Hospital, it will be on the 10th of February. And Dr. Harry Surti Regional Hospital, it will be on the 12th of February. And district hospitals in Springbok, Kuruman, and the R will receive 2,390 doses from Monday, which is 15th of February. All other hospitals will receive 970 doses from 22nd February 2021. The primary healthcare clinics and community healthcare centers will receive 1,790 doses from Monday, which is the 1st of March 2021. All other clinical support staff will receive 1,310 doses from the 1st of March 2021. The estimated rollout for the first phase is therefore a total amount of 9,450 doses of the vaccine. The plan is to complete vaccination of all patient-facing government staff by the end of March 2021. The private health sector will run a parallel vaccination process. The vaccine rollout in the province is being overseen by a steering committee, which is led by the acting HOD, Dr. Dion Tays. And this steering committee will, reporting to the steering committee, is the vaccine task team, which is project managed by the head of pharmaceutical services. It should be noted that everyone has a choice on whether they will be vaccinated. No one will be forced to vaccinate. So it's voluntary. If you don't believe in vaccination and all of that, nobody will compel you to be vaccinated. Vaccination, however, is the best defense against serious infection. The electronic vaccine data system has been formally launched. initially for healthcare workers only as part of this first phase of the rollout. While the vaccine is an important part of COVID-19 protection, it is essential to emphasize the continued practice of COVID-19 non-pharmaceutical behaviors, which includes correct wearing of masks, hand washing with soap, physical distancing of 2 meters, prompt presentation of care when symptoms identified, prompt self-isolation post-exposure or a positive test result, avoidance of crowded places, and adequate ventilation indoors and in confined spaces. I therefore call on every citizen, young and old, to be responsible and to observe all COVID-19 protocols. As I conclude, I want to state that the province has been hard hit by the recent rains causing extensive flooding in various parts of our province. The John Taolo Gaetsewe district being the hardest hit, with damages to roads, infrastructure, and properties. Tomorrow, the Executive Council, led by myself, will be visiting the region to assess the effects of the flooding. A report will be provided at a later stage. Please continue to play your part and stay safe. Thank you very much. There we are done now.
Thank you very much, Premier. I think I am audible, although I can't be seen. We will now allow our colleagues on Microsoft Teams, please indicate by using the tool that is there to raise your hand and pose a question to the panel that we have here. As mentioned earlier, we are here with the Premier, the MEC Liqueni for the Department of Health, along with our Director General in the province, Mr. Justice Beke Beke, and the Acting HOD for Health, Dr. Deontay and his team. So can we please have by a show of hands, questions to the panel? Thank you.
Are there any questions? If there's none, that's happy.
Let me start inside, and I have Benita Phillips from the DFA.
My question is, Premier, I think there's so many people that have got their own conception about the vaccine. Are there any healthcare workers that have declined to be vaccinated in the province?
Okay.
And how many are there?
My question is, Shalai from World Cosmopolitan. The fridges and the cold storage facilities in the province, how is that dealt with? Is it done by the provincial or the national government to help you get that vaccine cold enough? And how does these roads that have now caused people to drive major detours, if you want to go to, how does that affect your rollout? The roads that are now unusable.
Okay, where's the HOD of Health? Can you respond to the question whether there's any of our medical personnel that have declined vaccination for now? Do we know whether there's any? And but on the second question, Shane, we are going to JTG. We are leaving this afternoon so that we can just go to make an assessment of the extent of the damage. And the rains that visited our province over the past 2 weeks, they've done a major damage in JTG, and particularly to the road infrastructure. So tomorrow I'm taking a team of MECs. We are on our way. We go there, make a thorough assessment of the damage and what kind of interventions that we can come up with. Unfortunately, the distribution will start around the 10th of February. We've got about a few days on which we can actually start to work and develop an appropriate response to the damages which were caused by the rain in those areas. So
Dr. Zamani Saul, Premier of the Northern Cape, concluding that briefing there, speaking about the vaccine rollout, how it's going to be managed by a steering committee, saying vaccination is voluntary but is the best way of people protecting themselves from infection, as well as wearing a mask, properly, sanitizing and washing their hands and maintaining social distance. And that's where we leave it for the first hour on Point.